When it comes to containing costs in healthcare, everyone has their 2 cents to give. But what do those of us in the business of health insurance have to say? This is Health Sense, and I'm your host, attorney Adam Russo, CEO and co-founder of the FIA Group, a firm with over 25 years experience navigating this ever-changing industry. Join me and my guests as we make sense of effective ways to reduce the skyrocketing cost of healthcare while improving quality outcomes for patients. The only thing it will cost you is 30 minutes of your time. So let's get right to the bottom line and reimagine what healthcare could be. Hello, everybody, and welcome to Health Sense with me, your host with the most, Adam Russo, the show that gets right to the bottom line on ways to reduce healthcare costs while improving quality outcomes for you, your family, and your clients. We are sponsored, as always, by the best company in the world. Yes, it's mine. The FIA Group, the leading cost containment firm in the country, focused on ensuring that everyone gets access to high-quality, low-cost care. As always, please tune in at 10 a.m., 6 p.m., and for those night owls, and I'm sure Jen McCormick is not one of them, 2 a.m. Eastern Time on Healthcare Now Radio. As we always say, the main problem with healthcare in America is that it can be tied to Einstein's definition of insanity, where we do the same thing over and over again, expecting a different result. Well, that's what happens every year upon renewal, folks. They just keep telling you, increase your copays, increase the out-of-pocket, increase the deductibles, and somehow your people will be happier. Doesn't work. I know you're waiting for this. What is that word of the day? Our word of the day is Sophia. And we have a special guest to talk about that. Based on the positive feedback that we have received from our listening public, we are obviously now in the middle of our 5-part series tied to compliance and legal issues facing self-funded plans and their brokers. We are now at episode 3. No pressure on our next guest, but the first 2 episodes were a big hit. Ron Peck, my chief legal officer, was our guest. But tonight's guest is younger, smarter, and I would dare to say, little better dressed than Mr. Peck. And it is the FIA Group's Executive Vice President of Consulting, Jennifer McCormick. Say hello, Jen.
Hello. Thank you for letting me join today.
Well, I don't really know if you had much of a choice. You do work for me. Folks, a little bit of background. Jen joined us back when she was still in 7th grade in the year 2008 as an intern, an unpaid intern, which we kept quiet for like 10 years. Eventually she was like, hey, do I ever get a paycheck? And we're like, sure, we'll start you off at minimum wage. That was about 2018. But she joined us as a staff attorney without any experience in our industry. And now as the Executive VP of Consulting, she concentrates on healthcare and regulatory issues for employee benefit plans, as well as their administrators, consultants, brokers, you have it. Everything from plan exclusions, plan limitations, revisions, and then the entire summary plan description and summary of benefits and coverage. She is a constant contributor to the FIA Group's webinars and so many other educational media, including being in Benefits Pro publication, the Self-Insurer, and our very own FIA Group blog. Jen, it's awesome to have you. I know that you are a graduate of the National Football Champion Indiana University Hoosiers and also went to Syracuse College of Law. Well, that school hasn't had as much success in recent years. We can go back to the 80s and 90s maybe for that one. But we're so happy to have you here. So, Jen, I'm going to put you on the spot, if you don't mind. We're talking about today our 3rd part of our 5-part series tied to compliance and legal issues. If I had to ask you, what's the number one thing right now that folks in the industry are just not sure of, questioning, concerned about? What is that one thing, and what's your answer?
Yeah, it's a great question. And I think I have one thing, but the first thing I'll share is that it seems that this year, if we're watching what's trending from the healthcare regulatory landscape, from the lawsuits that we are starting to see filed, it's accountability. And when we talk about accountability, I'm talking about the actual evidence, substantiation, and things that you need to do to prove what you're doing. But the big issue, or the big question that keeps coming up is, how can I protect myself from getting sued as a fiduciary under ERISA? Everyone is very concerned because of this litigation, because it's not only a plan getting sued because a decision that was made, but TPAs and vendors and other consultants are getting sued for things that they are doing and not doing well or not doing.
So it's pretty crazy. Like, for years, I mean, I could go back 15 years. We've been advising clients to be concerned about the fiduciary litigation, the fiduciary breaches. And, no matter how loud I am, and I'm pretty loud, no matter how loud we shout it from the rooftops, nobody really paid much attention to the fiduciary issues that are just, to us, staring us in the face. What happened? You mentioned litigation, but when would you say was the turning point? At what point in time was it all of a sudden, it wasn't just a couple people asking, but now it's just this overwhelming number of, emails and phone calls that come to your office. When did that start? And what's a typical type of question? Are they like, hey, I think I did something illegal. Did I? Or is it more like, a friend of mine has this rash? How does it work? When did it start? And how do those questions come in?
Yeah, it's a good question. So we have an ongoing recurring call with a lot of our clients where we're going through what is happening in this space, some of the trending things that we would expect to see on Capitol Hill, some of the things that the states are doing from a stop loss perspective. And we started to see some of this litigation against plans, which was exciting at first because it never actually got that attention. And over the past year, I would say since June of 2025, we now have a dedicated section during these recurring calls where we're talking about fiduciary exposure risk. There is a concentrated, dedicated case every single month that we can talk to where somebody is in trouble for breaching or allegedly breaching their fiduciary duty. And I think the underlying theme when we're talking about fiduciary responsibility is, what is it that I need to do? I have made sure that I went through the RFPs and I made sure that I got the cheapest vendor possible. Did I meet my fiduciary duty? Because everyone is seeing there are a lot of these litigation and cases about making sure the fees are reasonable. The cheapest option doesn't make you a good fiduciary. What makes you a good fiduciary is by having a dedicated process in place. The agencies, the regulators, the judges, the attorneys, no one is looking to make sure that you check the box, did it right. They're making sure that you have a process that you follow that's repeatable. So the same experience for one member, for one patient is going to be the same as the next. And that is really the concern. We're seeing that, and it's missing, is that there's no responsibility or underlying obligations that these individuals seem to have when it comes to monitoring and following up and showing the evidence to substantiate what they're doing. Cheapest does not equal best.
Well, it's funny you say that because, if you look at most plan documents, it specifically says the plan has a duty, the fiduciary has a duty to be prudent with plan assets. Now, last time I checked, the definition of prudence is not cheap, right?
Right.
It's, doing what makes the most sense for the particular plan. What is reasonable for the plan? Having a reasonable process. As we all know, anyone that hires the cheapest contractor, buys the cheapest car, purchases the cheapest dress, those websites you can go on, you can wear it one time and then you throw it out. But is that the problem? Do most people feel as long as you go with the lowest price option from a vendor that you've met that fiduciary obligation? Would you say what percentage of your customers would you say fall into that bucket?
More than I'd like to admit, because a lot of individuals out there think that they have done their due diligence by going through and looking at a list of 5 different applications, policies, fill in the blank program to decide this one makes sense because it is the cheapest option and it can save money. But we're talking about being prudent. This is where you have the scales of justice that are coming into play because it's a balancing act. It's not just making sure that things are reasonable and that we're prudently managing assets. It's also the best interests of the plan participants. And you have to balance both of those things. And it causes you to do a little bit more of an investigation than looking online in an Excel sheet and deciding which of these makes the most financial sense.
It's funny because the way I look at it is if you look at our mission, highest quality at the lowest cost. It's not lowest quality at the lowest cost. It's not just we want to make sure everyone has low costs, because that quality and access piece access to care need to be there as well. So the number of times, folks, that I could tell you, hundreds, thousands, where I've been told, hey, guess what, Adam? We just made this amazing deal. We got this hospital to accept Medicare plus 10% as full and final payment for all claims that go to that facility. We want a direct contract. We want to steer everyone there. And I go, are they good? And they look at me like I'm crazy. I'm like, no, seriously, are they good? They go, what do you mean? It's the lowest price. Everyone's high-fiving. I go, yes, but you realize that that facility, for the surgeries that they typically do, based on all the quality metrics that we're looking at, that facility has the highest readmission rate of any facility in the area. Also, highest infection rate of any facility in the area. So sure, that initial appointment, that initial surgery, you got it at the lowest planned price possible. But they're coming back 2 weeks later because of an infection. They're coming back a month later to redo the surgery. So folks, it is a balancing act. You have to look for the lowest cost, but based on some type of high quality. And what if that facility only has 3 beds? I'm making that up. No hospital has 3 beds. But let's serious. If you make a deal and now you're steering all your people to one particular facility, how much access do they have? How long are they waiting for an appointment? That's another problem. So when you only focus on cost, that's what's going to happen to you. It's so funny because, there's always this challenge in the industry where people are trying to get you to be the lowest price. And I tell people all the time, I am not going to do a race to the bottom. At the end of the day for us, it is what's going to save the plan the most money, but ensure goodwill, ensure the least amount of noise. All of it is a balancing act. So when people tell me, well, they're willing to do this for 10% of savings, I'm like, yeah, they are. Adam, you're charging 20% of savings. Correct. Can you do it for 10? No, I can't. And the reason I can't is in order to get you 75 to 80% off your bill charge, I need to charge 20% because that's all the extra expertise, negotiation, skill, bodies needed to get that kind of pricing. If you want to pay us 10% fee, no problem. But when you're paying 50 cents on the dollar instead of 20 cents on the dollar, what does it matter what your fee is? You're still losing and wasting planned funds. And those planned funds, folks, that's the money, the hardworking money that members, workers, are putting back into the health plan to be used for claims. Jen, so just a quick one. I'm still wanting an answer a little bit. When did this start really picking up in your mind?
I do think it was last summer. We saw some of those cases that were coming out that were creating some confusion about what we should be doing, where we should be going, where we saw that 401k litigation in the past, where we saw a lot of litigation about fees and if they were investing in the right spaces. And it was last summer that we saw this first being applied by these plaintiffs' attorneys in the welfare and health and benefit plan space. And I think that was the turning point, because once one of these attorneys started to see that they could get some traction and start to build some of these class action lawsuits, others decided to do similar litigation and started to see this build. So at any given time, there's 4 or 5 cases that are at the lower level that are in the process of moving forward, that we're trying to figure out what will be the outcome.
And listen, plaintiffs' law firms are always going to find the next big thing, right? They had asbestos. They had the tobacco litigation. They had, whether it's Roundup and all, whether it's Camp Lejeune. They're always looking for the next thing. And that's why, in my mind, it was always like, wow, the 401k world got hit. When are self-funded ERISA plans and their administrators, brokers, etc., going to get hit with the same type of case? So, but Jen, tell me this too. I'm assuming you've had a recent call where someone says someone they know may have breached. How often does that happen?
It's surprising how many people know somebody, but it actually hasn't happened to them. Everybody always has a friend where they know some sort of hypothetical situation and they want to know whether or not doing this made sense, or was this a problem I exposed here because I paid for this person's claims and I didn't pay for these claims, or I reimbursed this when I shouldn't have.
So it's always a hypothetical, right? They always like this made up story, right? But yet they know exactly how much the bill was. They know the provider. They actually have a copy of that bill in their hand, but it's all hypothetical. Folks, if you're just joining us right now on Health Sense with your host with the most, Adam Russo, today our special guest as for part 3 of our 5-part series tied to compliance and legal issues facing self-funded plans is the Executive VP of Consulting at the FIA Group, Jennifer McCormick. All right, Jen, we got that first one down. What else? What other hot topics do you see as either we should focus on right now, or what do you see also coming around the corner? What's next to hit this self-funding train?
The next one is one of my favorites because it hits home to something we get to do every single day. This is my favorite comment that I'm hearing out there. We'll get someone who will reach out to us and they'll say, we've been in touch. It's been about 5 or 6 years since before COVID. You guys worked on our plan document. We should be good, right? There's always this thought that we haven't reviewed our plan document in 5 years, but nothing's changed. So I'm sure that everything that you reviewed 5, 6 years ago is still okay, and I'm safe and it's compliant, right?
Wrong. So if I put a gun to your head, what percentage of plans 5 years ago would you say do not have massive amounts of changes in a 5-year period of time? What percentage? Well, you can say, you know what? That's pretty good overall.
None.
What percentage? None. We're not even talking about some minor little thing. Like everybody. And that's shocking to people when you tell them that? Like, what is their reaction?
The reaction is, well, you reviewed it once, so this is a check the box and I'm done process, right? And the answer is absolutely not. So if you have made any changes for new programs, for new benefits, and it would be shocking to me if over the past 5 years, there weren't any tweaks to your coinsurance, to your co-pays, to the deductibles, to any new benefits that you're offering. And it used to be this scenario many, many years ago, back when I was in elementary school, where people wanted to maintain grandfathered status because they were so scared to change their plan. The thought was, if I make this change and I lose my grandfathered status, then I have to make other changes. But if you reflect on what they're actually saying, they're saying, what I don't want to do is make this change to my plan to lose grandfathered status because I'd have to cover preventive services at 100%, which isn't a bad thing, to encourage people to get preventive care. So a lot of the changes that have happened over the past 4, 5, 6 years are really from a cost containment perspective to create opportunities to strengthen the plan. This is an employee benefit. And that's what a lot of people forget. When you are an employer and you are offering this plan to your employees, you want them to use it, of course, the right way, but it's a benefit for them. It's one of the things that makes your company competitive and attractive. So why are we not advertising that we have added a new benefit that our participants, our patients are going to enjoy, instead of hiding behind it and tucking it in the drawer and ignoring it?
Because they're thinking it's going to cost more money to the plan. The last thing that a broker wants to do is go back to their client and say, oh, you have to pay more. Never mind that it's actually going to be preventative, meaning it's going to stop them from having larger claims potentially down the road. Now, my question that I want to also make sure we don't forget is, what's next? Plan docs are always a big issue. Obviously, the laws change. People have to keep them updated. You have to make sure you reach out to the FIA group in regards to your plan document needs. But what do you think is coming? Anything that you're starting to see, whether it's carve-outs, whether it's PBM, what is it that you see as potential issues that are starting to get some traction in your world?
I would say there's 2 things that are really relevant lately, and we have been going out of our way to try and educate and be proactive about this. And the first one is PBMs, and the second is stop-loss issues. And we're talking about the PBM space. We've seen all of this litigation. There's a lot of litigation that's starting to happen now, too, about, did you agree to this? You didn't review that contract. You signed up for this. Well, you're the fiduciary. That's your responsibility to audit a contract that you never otherwise would have had access to. And the concern when it comes to that brokers and plans are asking us, what is my responsibility to understand when it comes to the PBM? What am I, plan sponsor, supposed to do? Who am I supposed to ask? And what am I actually responsible for changing? So this is the time now, before a lot of this regulation and there's new criteria. Every contract, every PBM contract will need to be reviewed. There'll be provisions that are in the contract that will be illegal in the next 6 to 18 months. You'll have to make changes to those contracts. So if you can start to collect them now, there won't be a surprise when you know what you need to change. And you are the fiduciary responsible for making sure those get changed. That's not the PBM's responsibility. That's you as a fiduciary. Review your contract.
Well, I guarantee you, Jen, maybe 5% of the listening audience and 5% of the brokers out there that you tell this to will actually do it right now. What's going to happen is they're going to come to you 2 years from now and tell you that one of their friends has this issue. So don't forget, I brought up the word of the day, Sophia. Now, many of you are like, oh, that's a pretty name. You know, I have a friend whose daughter's name is Sophia. What's the big deal about that? Why is that the word of the day? Jen, you want to talk about some of what Sophia means in your world and why it's so exciting for you and for the industry as a whole?
I think Sophia is a great name. It is just Sophia. And there are a lot of really exciting things about Sophia, but the thing about this tool, and it is a tool, and one of the reasons we've created this is to make our lives internally easier as much as it is to make externally the lives of our clients easier as well. It is a curated chatbot, which has other functions. I'll talk about the chatbot function first, where it is able to use all of the information that we have collaborated on, that we have created, specific to industry issues that our plans that we are talking about, that we are seeing on a daily basis. So this isn't going out to Google or even ChatGPT and asking questions where there's not the context or the expertise particular to what we do on a daily basis with these situations. This is curated and layered in the sense that we can get information that is up to date about the issues and the questions that are facing. This is our team is able to use this tool, and this is something that our clients are able to do. If they're on a call with a plan or a vendor or a broker and they need a question answered immediately, you can just type into Sophia and the question will be at your fingertips, giving you bulleted information about how to respond and considerations for that too. So it is really a great tool that is customized and unique to this space.
That's absolutely great, Jen. I'm really happy that you brought that up because obviously, time is money and people want quick access to real good information that makes sense for them and their clients. So what else is out there, Jen? We talked about plan design. We talked about the fiduciary risks, even with plan design, right? Well, if you don't update your plan doc and you're not covering things that are required to be covered, there's a fiduciary breach potentially there as well. So all of it ties into the fiduciary breach. What other types of issues do you see a lot of, or what are things that you think maybe people aren't paying attention to right now that is top of mind in your world?
Yeah, and on the theme of Sophia and accountability, the other big trending issue, and this has been on and off, and where am I at, and is this enforceable, is this not, is in the mental health parity space with these NQTL comparative analysis requirements. And the theme seems to be from litigation and fiduciary exposure, not just documenting that you made a decision, but how did you make that decision? And that translates very nicely to the mental health space, because there is this requirement that was part of the Consolidated Appropriations Act that you have to have a written and documented NQTL comparative analysis. And whose responsibility is it to make sure that this is done? Which is a really interesting question, because the data that you need, you get it from the administrator, you get it from the PBM, you get it from the network, and you get it from the UM. So all the information that is required to be included and analyzed as part of this analysis, the plan sponsor can't get on their own. They need help to do it. And generally that is the broker who is guiding them through this process. So right now there are rules in place. You are required to have this. There are ongoing audits right now where a individual is, or a company is being sued or audited because they do not have the documentation in place to show that they are compliant. It doesn't matter if you say you are or if you are not. If you don't have a 100-page document that is the evidence to substantiate that, then you're going to get fined and publicly shamed because they're going to put your name on a list and distribute it to everybody.
So, Jen, a little personal question here. You sound so passionate about this. I assume that when you were an undergrad at the fine institution of, the Hoosier land, this was what your dream was, right? To be one of the experts in employee health benefits in the country. Was that your dream all along? Or what was it that you actually wanted to be?
Growing up, there were two things that I wanted to be. And my mom was just sharing this with me in my second grade handwriting. She said, you always said, Jen, that you want to be two things: a lawyer or an actress. I always had that in mind. That was my dream. I wanted to be on television, or I wanted to be a lawyer. And my law journey obviously was the one that won there. But I originally wanted to be a family law attorney, if you can believe that. And I took a clinic and a class, and it was really challenging in that space. There are a lot of emotion and a lot of bringing things home that I wasn't able to do. And I transitioned to taking a taxpayers clinic in law school. And during that clinic, I got exposed to the code. And it was so cool to try and advocate for low income taxpayers and use the code as the reason for why they could make a deal with the IRS.
That's awesome. It's funny, how many family attorneys I know that aren't married. It was always an interesting thing to me. Because I'm like, I can't imagine you're a family law attorney, you're a divorce attorney, right? Custody battles, etc. I can't imagine then going home going, you know what? Maybe I should get married. That seems like a really good idea. Maybe I should have some kids. It's like all you hear is negative. So it must be really hard to then come home and go, oh, look at my happy family. Is my husband or wife doing that too? Are my kids a problem? It's very interesting you say that. But you know what, Jen? You are an actress. You're on stage. You're on stage all the time doing performances, presentations. Now, it might not be a movie or a Broadway play, but you're still talking about self-funded plans and all that fun stuff you love to do. So, folks, that is all the time we have for today. I want to thank my guest, Jen McCormick, the Executive VP of Consulting at the FIA Group, for joining us, Jen. It was an absolute pleasure to have you here with us today.
Thank you so much for having me.
I hope I can bring you back. We'll see. Folks, as always, thank you so much for joining. And as always, let's go Cleveland Guardians. Have a great day.